Okay, it looks like we are at the top of the hour. We're going to go ahead and get started. And I'd like to welcome everyone to the call. My name is Valerie Weber, and I serve as the Community Impact Director here in Akron, Canton, and Youngstown with the American Heart Association. I'm going to be your host and moderator for today's community conversation. This is part 3 in the series, and today's focus will be on stroke, with May being American Stroke Month. Today, we will discuss risk factors for stroke and how to minimize your risk, how to access care and telehealth services, what stroke survivors and caregivers should be aware of to help avoid a second stroke, and tips and strategies to support health and wellness with resources from the American Stroke Association. As we begin the conversation today, please feel free to use the chat option to send comments and questions as our conversation evolves. We're going to have Q&A toward the end of today's session. So right now we're going to go ahead and test the chat option out quickly with everyone else that just joined the call. So please look at the bottom of your screen. You'll see the chat box. Go ahead and say hello and make sure it's working on your end. Okay, excellent. All right, thanks everyone for joining. And we're going to go ahead and get started, and I'm pleased to introduce our panel of experts and would like to take a moment to thank each of our panelists for taking the time today to bring their expertise to this community conversation during this very busy time. And I'm happy to introduce Dr. Sadar, Medical Director of Structural Heart Disease at Altman Hospital, Julie Dominic, occupational therapist at Mercy Medical Center, Erica McCullough, stroke coordinator at Mercy Health, and Stephanie Mole, vice president at the American Stroke Association. This stroke community conversation is powered by support from the Bill Phillips Legacy Foundation. So we're going to go ahead and jump right in, and our first question is for Dr. Sadar. The first question is coming here is, what are the risk factors for stroke and how can we minimize our risk?
Hi, good afternoon. Thank you for giving me an opportunity. Whenever we are talking about stroke, stroke is not a disease. I always believe that it is a kind of a very bad news, that probably the worst news that a person can get. Because there are many diseases that we treat, but stroke is one of the diseases which is disabling. And I always tell my patient that this is something that we should not even wish for our enemy to have a disabling life. Stroke has many risk factors. There are some which are modifiable. There are some which are not modifiable. What I mean by that is this. There are few things in your life that you can change, like you can quit smoking. You can obtain a healthy lifestyle by exercise and diet. But if you have atherosclerotic disease history in your family, you will not be able to change it because this is something that is running in your genetics. But of course, you can modify it to delay it as much as possible. And last but not the least, there are certain diseases which are per se not modifiable, but there is a treatment available for those diseases. Like if somebody has high blood pressure, we all have very good medications and they have shown extreme benefit. If you take them and you optimize your blood pressure well controlled, you can reduce the risk of stroke exponentially. The most common cause of stroke when somebody is above 70 or 65 is atrial fibrillation. I always tell my patient that one of you must have at least one family member who has abnormal heart rhythm. This is the most common abnormal heart rhythm that runs in the world, where millions and millions of patients have it. We all know it causes stroke, but unfortunately, not all of the patient takes medication to prevent stroke, which is blood thinners, like Coumadin or Coumadin-like drugs. So in short and in summary, the biggest risk factor for stroke is unhealthy lifestyle, smoking, lack of exercise, lack of good diet. As you get older, your risk of stroke increases. Third, if you have high blood pressure, that is a very big risk of stroke. Fourth, the most common cause of stroke above 65 is atrial fibrillation, which in layman term is abnormal heart rhythm. Hope that helps.
Yes, thank you so much, Dr. Sadar. And to kind of expand a little bit upon that, the next question is for Erica. When we discuss risk factors such as high blood pressure, can you touch on high blood pressure and the importance of knowing your numbers? As we know, many people are not aware they have high blood pressure, with this being a big risk factor for stroke.
Sure. Hi, guys. Thanks for having me on the call here today. Specific to high blood pressure, certainly one of the more significant risk factors for stroke. And I would say this isn't unique to the Mahoning Valley here, but we tracked patients who came to the hospital and saw that at least 80% of those patients were presenting with a history of high blood pressure. And it's tough to say really how many of those had well-controlled blood pressure coming in at the time of their stroke. But we know that high blood pressure, it often doesn't come with symptoms until it's maybe too late at that point. But those underlying changes that are happening before we really notice it is, the pressure that exists in the vessel walls is causing the damage that can lead to this atherosclerotic disease. It can also lead to weakening of blood vessels that we know is linked to hemorrhagic stroke as well. So, we stress it's very important for patients to, especially if they have a history or recently have had adjustment to their medications, to monitor their blood pressure, with the goal of really targeting those numbers. So with, a normal blood pressure should be less than 120/80. And, we suggest that patients, by the American Heart Association guidelines too, they recommend checking a blood pressure twice a day, once kind of first in the morning and one in the afternoon to see, is your regimen working? If not, you should be having those conversations with your provider to see, do your medications need to be adjusted? I think one thing that just in conversation with patients is, they maybe feel defeated by the fact that their blood pressure is not controlled, and they think that that's maybe, the fault of something that they're doing, and that they're trying to control these other risk factors such as smoking and high cholesterol and these other factors that we know put patients at risk for stroke and can also lead to high blood pressure. But sometimes I think it's just a matter of, as our bodies change, so do our medications, and that it's not necessarily to the fault of what they're doing at home. But I think it's important to really to give the patient or the person that kind of control over their health, and knowing your numbers is one way of doing that.
Perfect. Thank you so much, Erica. And we did have a follow-up to that that's coming through via social media. One of the community members is asking if your blood pressure medication has helped to lower your blood pressure somewhat, but it is still above that 120 with the medication. How much does that really increase the risk of stroke? Can anyone on the panel touch on that a little bit?
So you're saying that, even medication, while it's improving their blood pressure, it's still not at goal? Okay.
Yeah.
I think there's still continued stress and damage that's occurring even when the blood pressure maybe not as elevated as it once was when you started treatment. But certainly, it's that may be where that discussion with your provider and saying, okay, maybe we need to add an additional medication to get it to the goal that we're looking for. So while it's certainly better than probably where you started during this journey, there's still some risk associated with it being elevated above that 120/80 mark.
Got it. Thank you. So what I heard you say was they should really get with their healthcare provider, their doctor, to reevaluate the medication, and that may help with the adjustment to get it under that 120/80. Does that sound right?
Yeah, and I would say that for some patients, while the traditional goal is 120/80, dependent on other risk factors, that can vary for some patients. So I think having a discussion with your doctor is probably the best.
Perfect. Thank you so much, Erica. Next question, we're going to toss it over to Julie. And Julie, can you touch on how individuals can access telehealth services and other support services in the community?
Yes, so most physicians are doing telehealth currently. They are, you can call your provider and you can request a telehealth visit, and most providers I know in my community are doing telehealth as an option currently. Many of them still will see you in the office, but if that's not comfortable for you for a given situation, because you might be at more risk because of the coronavirus situation, telehealth is a very viable option currently. So I would encourage people to certainly explore that with their providers. You're able to do that through most of the internal medicine, family medicine practitioners, and certainly some of the specialists as well. So it just depends on your situation. So certainly we want to encourage you to understand that it's very important to see your provider on a regular basis. If you're taking medication, that means that you should be there at least every probably 3 to 6 months, having a visit with them, whether it be telehealth or in the office, so you can discuss what your situation is, because you want to make sure that your medications are being monitored in addition to you monitoring the blood pressure issue. If you're diabetic, your blood glucose levels, those type of things. So those are all very important with regards to the current situation. So can you still, are you still getting me? You got me still?
Yep, I can still hear you.
Okay, thank you. I went black on my screen, sorry. The other thing, there are a lot of, there's a lot of good information out there. The American Heart Association, American Stroke Association has wonderful educational information when it comes to strokes via online options. You can go on their website and get all kinds of educational support. How can I prevent a stroke? That information is all very readily available. And I'm going to talk a little bit later about some specific support groups for folks that have had strokes, but we'll get to that in comments in a little bit.
Excellent. Thank you so much, Julie. And then Erica and Dr. Sidar, would you like to touch on telehealth services available potentially in your area as well?
Sure. We are offering telehealth services to all form of cardiology patients. We have basically telehealth service, which is called Altman Now, which is available not only to the patient themselves, but also available to the rehab. We are doing 95% plus of our patients, especially in this COVID atmosphere, all visits, telehealth services. Even, there are, I just wanted to basically tell most of the patient and the listeners here that 50% of the examination and things that you really need in an office setting can still be achieved by telehealth services. So I would definitely like that, my patient sees me via telehealth rather than not coming and seeing any physician provider or, provider at all and having something bad happen to them. We also have some other apps that we are using as a telehealth option. Some of the apps are basically made encrypted, which are called Doximity. Doximity is an app which is very user-friendly for some of the patients who are challenged by internet. This is only a text message services that is being sent to the patients, and they can actually click the link on their phone and it will connect as far as they have a smartphone. So we have telehealth services and we encourage them at Altman Hospital, especially in this COVID environment.
Excellent. Thank you, Dr. Sidar. And Erica, would you like to touch on the telehealth as well?
Sure. I mean, similar to both of the other systems, Mercy Health, we're seeing a majority of our patients through telemedicine, either through their MyChart. There's a way to do virtual visits by their phone, using Skype on the phone to interact with the provider. We also, for some patients who don't have smartphones, we're using a platform. It's called Doxy.me. It's kind of like a Zoom virtual office visit, if you will, that again is similar to other telemedicine programs or platforms. So both of those are options, as well as being seen by a provider if that's still necessary, as well as if kind of we're limited to any of those types of visits, we are also doing phone encounters, at least to make contact with the patient and make sure that the plan of care is underway. So to access those, it's mostly by contacting whichever office, whether that's your primary care provider or any of the specialty offices, and they'll arrange whatever type of visit is most appropriate for you.
Excellent. Thank you so much. And I know that we have some other health systems that are on the call. If you would like to enter some information about telehealth that's available at your facility as well, please feel free to do that in the chat. And then for everyone else, as a reminder, if you have questions, you can go ahead and enter those into the chat option now, and we're going to be having Q&A toward the end of today's call, and we'll make sure that we get to those. Okay, so we're going to go ahead and back over to Dr. Sidar. The next question is, what should stroke survivors and caregivers be aware of to help prevent a second stroke?
That's a great question. Like I was mentioning that, stroke is a disabling thing. We should try our best that we should never have a stroke to begin with. But if we are in a situation, one thing is very clear, that if a patient has a stroke one time, they are at very high risk of having a stroke another one. Like we know the causes of stroke, like I alluded before, there are some modifiable things that a patient can do in their life. And we call that lifestyle changing things, like diet, exercise, eating healthy, control of blood pressure. In fact, if you already have a stroke, you need extreme, tighter control of the blood pressure rather than conservative. Smoking cessation. And last but not the least, there are few things that you can do which are treatable in terms of medication, like cholesterol lowering medications, which are statins most of the time. I'm sure most of the listeners are familiar with statins. If they are not, then these are cholesterol lowering drugs. Atrial fibrillation is a very common cause, and it is easily treatable with blood thinners. So modifiable causes should be modified, treatable causes should be treated.
Thank you so much, Dr. Sidar. And this may be a follow-up to what you just talked about that's just coming through in chat. Amber's asking, she has fibrillation and was on medicine about 4 years ago, and her doctor said all heart-related medication was no longer necessary. She was wondering what her chances of having a stroke would be now since she's not on the medication. She's also wondering if she should talk to a new doctor about going back on heart medication. Dr. Sidar.
Yeah, atrial fibrillation is a disease that can happen actually at any age. We have a risk scoring system when we decide that how long and what medication a patient should be on. And the medication to prevent stroke in atrial fibrillation is specifically blood thinners. If she was told that she should be on blood thinner and she had atrial fibrillation in the past, which led to the stroke, very often and most often, she should be taking this drug for lifelong, unless and until she had a complication with that medication, like she bled or she is not tolerant to that medication. That's a different scenario. So I'm not familiar what exactly happened, but I would say that if she had a stroke and it is related to atrial fibrillation and she is not taking any blood thinner, there has to be a very good reason why the doctor took you off. And yes, if it makes it easier for her, she should take an opinion.
Thank you, Dr. Sidar. We're going to pass it back over to Julie now. And Julie, can you touch on the value of support groups and why someone might consider being part of a support group?
Absolutely. I've been had the honor and the privilege to co-facilitate a community support group here in Stark County for over 25 years, and we have a wonderful group of individuals that get together on a monthly basis. Unfortunately, the COVID has changed that for recent times, but hopefully we'll be back together again soon. But what I have learned and what I think the purpose of support groups, one of the things is being able to be in a group where people can share their personal experiences and have that sense that they're not alone. It often offers the emotional and the moral support that they need. We talk about tips for kind of problem solving and helping people to cope with what they're dealing with. I mean, Dr. Sadar said it earlier, there is, when you have a stroke, it can be very life altering. It can be extremely debilitating, but there's different levels of that debility. So you may be somebody that's had a stroke and you actually look on the outside like everything's going pretty well. But unfortunately, maybe your speech is affected, or maybe your thinking ability is affected, or maybe there's other things, your emotional state has been affected. So, it's hard sometimes to really wrap your mind around that stroke experience, but when you can get into a group situation where you're with other people that actually have that same kind of unknown experience, it's very, very helpful. I've been told that people feel less isolated, they feel less lonely, they feel less judged, especially if you have physical symptoms that people see on the outside. So oftentimes they encourage each other. That happens all the time. And actually we build friendships, which lifelong friendships, honestly. I'm blessed with knowing so many folks that have gone through the stroke experience, and that's part of their journey. The other thing that I want to bring up is that, a stroke experience can cause somebody to be very anxious. Self-esteem is very, cut in half oftentimes, especially if you have physical issues. And this getting together and discussing some of those problems and concerns actually helps people have an improved sense of self and self-worth. And it's a great opportunity, I think. And that's true for all support groups if you're dealing with other issues, other medical conditions. But I definitely think there's it's a great resource. What I have found is that folks that want to try to see the other side of their stroke journey, stroke support groups are very helpful. Those that want to really focus on what they can't do and the negative side of it, it tends to be less effective for those folks. So I think attitude has a lot to do with how we deal with many things in our existence. Currently, the situation with the virus has a lot to do with attitude too. So hopefully that's helpful.
Yeah, thank you so much, Julie. Are you shifting over to a virtual format? I know we're going to help host a virtual support group. Is that something that's in the works with other support groups in the area? Can some of the panelists touch on that?
I know that we, just to go back to what I was just talking about, we are going to do a virtual Zoom meeting for our stroke support group next week, and we'll see how that goes. I know some of our members are not technologically savvy and don't have access to things that will allow them to join us. So we are hoping to get back to an in-person meeting as soon as possible, and we will social distance and do what we need to do. But seeing each other in person is very helpful for our group of folks. I do know that there are some other groups in our community that are trying to do things virtually as best they can. So it definitely is helpful to see faces and to talk to each other. So even reaching out via phone conversations can be an assist. So.
Excellent. Thank you so much. And Erica or Dr. Sadar, do you want to touch at all on support groups as well, and anything that's available at your facilities via support group?
Yeah, sure. So currently, we've been kind of on a pause for the last couple of months. In the Mahoning Valley, we recently started rotating the locations of our stroke support group. So unfortunately, we utilize different like facilities throughout Mercy Health, and a lot of those have visitor restrictions at this point. But looking at the possibility of a virtual visit, because I'm not sure as far as the restrictions for those sites, how long those will continue into the future. And at this point, we've already postponed 2 meetings, so it seems like it's the unforeseeable future of when those could be lifted, that a virtual visit would probably be the best option.
Excellent. Thank you so much. Dr. Sadar, did you want to touch at all on support groups over at Altman and anything that may be available for the community?
Yes. Yeah, I was actually asking Tana the same question, because I was not very familiar what the support group services are at Altman. I'm sorry about that. But she was showing me that there are support group services available on the website, which I'm not very familiar with, but I'm sure because of COVID, there must be some kind of interruption the way that they carry them out. But I'm sorry, I don't know in a lot of details about that.
Okay, thank you so much. And it sounds like, for all of the health systems, folks are able to access more information via the websites, and we're happy to share out additional information as it becomes available, especially for those that are shifting over into a virtual support group for the time being, just so that the community is aware of what's available to them. So we're going to go ahead and toss it over now to Stephanie. We're very lucky to have Stephanie on the call as well today. And Stephanie's going to touch on American Stroke Month. So with May being American Stroke Month, are you able to share the American Stroke Association's messaging priorities and why these messages are more important than ever?
Yes, thank you, Val, so much for inviting me to join you today. And happy American Stroke Month, everyone. The American Stroke Association is leveraging its American Stroke Month campaign to address two important problems that hinder stroke survivors from living longer, healthier lives. The first is that 1 in 4 strokes, 25%, are actually recurrent events. And unfortunately, as you heard from Dr. Sodar, the second stroke tends to be more deadly or more disabling. So we really want to try and help survivors prevent another one. Unfortunately, many survivors are unaware of their risk for a recurrent event, even though up to 80% of recurrent events may be prevented by using a lot of the strategies that Dr. Sodar talked about, such as staying physically active, eating a healthy diet, taking all of the medications that your doctor has prescribed for you, etc. And of course, during this COVID-19 pandemic, it's more important than ever that stroke survivors stay healthy and take steps to prevent another stroke in order to prevent a hospital stay that can potentially be avoided. The second problem that we're addressing this month is that we still miss way too many opportunities to treat stroke patients acutely during the treatment window because they don't recognize the stroke symptoms and call 911 to get to the hospital quickly. Unfortunately, this problem seems to be exacerbated during our current public health crisis. Some data that we have show that there's been a 20% reduction in stroke EMS call volume during the first quarter of 2020, a likely indicator that those with stroke symptoms are not seeking treatment, even though stroke is still a medical emergency. So while it's always important that we educate the public about stroke warning signs, now, especially during this COVID-19 crisis, consumers need to know that calling 911 fast is the best response if they suspect a stroke. And I would encourage you to help us share these important messages however you can.
Excellent. Thank you so much, Stephanie. And follow up to that question, what resources can you share that are available to the community?
Sure, thank you. We have lots of great resources for you to share with family, with patients, and your community. We have a slide that Jessica's going to share, there you go, that summarizes many of the new resources that have been developed for our American Stroke Month campaign. You can find all of them on our website at stroke.org/oneisenough. That includes a lot of the secondary prevention resources, as well as FAST resources. I particularly want to highlight for you our new infographic. It's called I Will Prevent Another Stroke, which is available in both English and Spanish. And we also have a new video called One is Enough that is available in both 15-second and 30-second versions, and the 15-second version is also available in Spanish. So those are terrific resources that can be shared via social media or by linking to our website or however else you might feel led to share them. I also wanted to highlight that for healthcare professionals, we have a secondary stroke prevention checklist which I think would be a great resource to use during a telehealth visit with a stroke survivor. And it cross-references the American Heart Association and American Stroke Association guidelines, and highlights why particular risk factors are important to address. We also have a lot of existing assets and resources that can be helpful to stroke survivors and their families during this difficult time. And so I did want to highlight a few of those. So for example, you know, and you heard from Julie, we know that stroke can be a very isolating condition, even when we're not in the middle of a pandemic. And, you know, both because of some of the physical consequences of stroke that can make mobility difficult, as well as some of the speech and cognitive difficulties that can cause isolation. So, for example, to help address physical activity, understanding that survivors may not be able to get to their gym or to get to their physical therapy outpatient appointments, we have a series of 29 post-stroke exercise videos that are available on our website. Each exercise is demonstrated by a physical therapist and are specifically intended to be done by stroke survivors. So we hope that they might be helpful to stroke survivors during this time. We also do have our Stroke Family Warm Line. That phone number is 1-888-4-STROKE. That is available for stroke survivors or their caregivers to call. And our trained call center staff are specifically there not only to answer questions about stroke, but also just to be a listening ear for people. And so I know it's very difficult, and stroke survivors are missing their in-person stroke support groups. So hopefully that Stroke Warm Line might be able to meet a need during this time. And then finally, we do also have an online support network that you can find at supportnetwork.heart.org. And that support network has within it communities specifically for stroke survivors as well as for stroke caregivers, where again, you know, might not be quite as good as that in-person visit, but it still provides an opportunity to connect with other stroke survivors or caregivers and ask questions and share your experiences with each other. And finally, I did also want to mention that in response to the COVID pandemic, we have also developed a series of 4 podcasts that focus on different ways that stroke survivors may be impacted during this time, and provide some resources and tips and strategies for overcoming those difficulties. So each podcast features a stroke survivor as well as a stroke expert, and they focus on different aspects of stroke and COVID. So the first one focuses on basic information that stroke survivors should know about COVID and how they may be potentially impacted, as well as how people who haven't had a stroke can be potentially impacted by the coronavirus. There's also a podcast that focuses on how to stay emotionally healthy and well during this time. One that focuses on physical activity while staying at home for stroke survivors. And then finally, the fourth one focuses on financial challenges. So all of those podcasts are also now available on our website at stroke.org.
Excellent. Thank you so much, Stephanie. What we're going to do now is we are going to shift into the Q&A portion of the call. So this is going to be open to all of our panelists to answer, and we're going to go ahead and take a look into the chat box. So if you do have a question, please enter it now, and we're going to go ahead and start at the top here. Okay, so the first question that I see, there is some evidence that young adults diagnosed with COVID-19 have an increased risk for stroke. What recommendations for addressing young adults increase risk for stroke? Any comments on that?
So I can take that. Yes, you're absolutely right. There is now a lot of evidence, especially from the series that are conducted in Italy and United States, that patients who are young, in fact, may not be even young, patients do have increased risk of thrombosis. Thrombosis means increased risk of forming clots. What's the exact reason for forming clots? We don't know. Maybe it is just a whole inflammation cascade that started with COVID. But there is a very good study that came out from Mount Sinai in New York City, where they actually treated patients of COVID with blood thinners. I may be wrong in saying that they use blood thinners like newer oral anticoagulation agent, which do not require INR monitoring, but maybe I'm wrong. This can be confirmed again. But that study clearly showed that if patients are given blood thinner, they actually have a better survival. And we all know that patients who have stroke, they have worse survival than any patient who do not have stroke. Hope this helps.
Thank you, Dr. Sidar. Our next question that's coming through, this is a question, looks like she's asking, if your 70-year-old mother has high blood pressure but has never had a stroke, that person's asking, am I at increased risk for having high blood pressure as well, genetically? And this person's saying that they are 39 years old. Any comments on that from the panel?
I can answer that. If somebody wants to chime in later, they can add more. I always tell my patient the magic number where your risk of stroke does increase, regardless your risk factors or not, is 65 and above. For female especially, but for male as well. If you have high blood pressure on top, you definitely have to make yourself more controllable in terms of your blood pressure, because if you don't control it, this is basically losing the control over your life. You will be actually going to be much higher risk of having stroke. High blood pressure runs in family. Stroke also runs in family. They go hand in hand. If your mother has high blood pressure before and stroke before, yes, you need to be more aggressive with your lifestyle changes, regardless of your age group.
Thank you, Dr. Sidar. The next question coming through, are there support groups or special initiatives for African Americans that have a higher risk of stroke? Any comments on that from the panel?
Val, I can take that. Oh, go ahead, Julie.
I was just going to say that, to my knowledge, I know in our community that's not necessarily the case. Our group is all inclusive. We have people of different ethnic backgrounds, different religious backgrounds. So that's not something that I'm aware exists. Now, we do talk about those issues when they come up, when people have questions related to risk factors and who's maybe at a higher risk. But a lot of support group issues are related to the after effects of having a stroke. So, and of course that, it doesn't matter gender, ethnic, religious, any of those things aren't really, aren't issues as much after that, as long as you're addressing your risk factors.
And Val, I was just going to add, the American Heart Association does have our Empowered to Serve community initiative that includes lots of great resources for African Americans as well as Hispanics who are at increased risk for stroke as well as for heart disease.
Excellent, thank you. We'll be sure to share those additional resources, and be sure to share all the resources that were mentioned on today's call. So let's go back to the chat and take a look here. Okay, so the next one, and this looks like it's coming from Pauletta. So we have recently begun offering telehealth visits as an option for some of our chronic disease patients at Summa Health Equity Center. We use WebEx because it's advertised as a HIPAA compliant. Additionally, our centering pregnancy and centering parenting class groups have been online for the past 2 months at a regular basis through WebEx, formerly through Zoom. And they're also working on preparations to launch obesity management and prevention program in an online format. And as well, due to COVID-19, many organizations are looking at this more and more. And they also are working on offering more online education and support. Excellent, thank you so much, Paulette. Will be sure to share that out with the group as well. Okay, the next question that's coming through, do you recommend a specific diet for prevention, such as being vegan? Any comments from the panelists?
I could touch a little bit on that. I guess I wouldn't say that vegan or vegetarian or any specific diet. Certainly, I think having kind of a balanced lifestyle, whether you choose to eat meat or not, is is probably kind of the way to go. Limiting that processed foods, things that we know that are high in saturated fats and in sugars that ultimately lead to potentially obesity and other conditions such as high blood pressure, high cholesterol, and diabetes. So I think if you're kind of getting that good balance of nutrition from whether it's like I said, meat products or not, I think that's kind of the key is to limit the sugars and the fats.
And sodium as well.
Yes, thank you.
Yep, excellent, thank you. And we can share out resources as well via healthy recipes and so forth that are available on our website at heart.org, and we'll be sure to include those as well. And then the next one that we have coming through via social media. So with all that's going on in the world, many are concerned about going to the ER, but we know it is very important to seek help immediately if you have any signs or symptoms of stroke. And the community members asking if ERs are safe to go to right now. And I know that Stephanie touched on this a little bit, and also I believe Dr. Sidar. But could you touch a little bit more on this and help with the reinforcing on this question?
Sure, this is Stephanie. I will take that. So it is absolutely critical that people still do call 911. And by doing that, first of all, emergency medical services can triage you and, determine if they believe that you are having a stroke. And then they can also, if in fact you are having a stroke, begin, some initial screening while in the ambulance. So that will help you get treatment more quickly once you arrive at the hospital. They also can know best what hospital to transport you to so that you get the most appropriate treatment. And then finally, I think virtually all hospitals these days are taking steps to make sure that patients are being kept separate from COVID patients, and making sure that PPE is being used, and taking all of those steps to make sure that you in fact will be safe if you do need to call 911 and go to the hospital either for a stroke emergency or for a heart attack emergency.
Yeah, and Val, just to piggyback on that, I think more of the response to COVID, at least I imagine many systems have done this, where we've set up these almost like triaging flu clinics out in the community so that we're seeing less of those patients arriving to the emergency department. So actually the volume of patients in the ED, I would say, at least here in the Youngstown area, is probably less than half of what we're used to normally seeing. So I think the system has done a good job at trying to really manage those patients either at home, or if they do truly need to be admitted to the hospital, that they're kind of bypassing that emergency department, or having truly those critical patients being managed in the ED. So like Stephanie said, they certainly are separating them, and I think trying to limit the exposure to anybody, staff and patients as well. So certainly calling 911 and getting to the emergency department for a stroke is equally as an emergency as other conditions, including COVID.
Thank you so much. Do any of the other panelists want to touch on here locally as well, what your hospital or facility is doing just to help ease some of those concerns? Because we know there is a lot of anxiety in the community. This is a question that's come up over and over. And we know that, our healthcare facilities are doing everything that they can, like Erica and Stephanie touched on, to separate patients that have COVID versus non-COVID related. And we know that time is of the essence when you're having a stroke or heart attack. So it's extremely important to call 911 immediately and not delay. So can Dr. Sidar or Julie, do you want to touch on, how your healthcare facility here locally is doing that, or help to reinforce some of what Erica and Stephanie said?
Yes, that's a great question. That how to differentiate between the urgency that is required for preventing a COVID versus avoiding a stroke, or timely reaching to a facility to avoid a stroke. Like, we said before, stroke can manifest in many different shapes and form. Yes, COVID is pandemic at this present time, but we also know that 80% of the patients who even may have acquired COVID, they are often asymptomatic, but stroke is disabling. The only message that I want to pass on to every listener out here, that the stroke is disabling. Stroke has a treatment available if you reach in time. COVID pandemic is very concerning. We all are facing and going through it. But if you manifest any of the symptoms, which you can actually look at American Heart Association website, they have laundry list of symptoms that a person can have because of the stroke. Like every hospital in the country, our hospital is also taking this matter extremely strictly. We do ask questionnaires regarding potential COVID infection or coronavirus, like fever, sick contact, travel. And if those symptoms are present, we have strict guidelines to how to isolate patients so that not only they are safe, but also the healthcare worker as well as other patients in the hospital are safe. But please, my message is stroke is disabling. Please take care of it in a timely fashion.
Thank you so much, Dr. Sidar. Julie, did you want to touch a little bit on what you guys are doing over at Mercy as well?
Yeah, I mean, we're in the same situation as Dr. Sidar and Altman. We are taking all precautions to take care of the folks that are coming into our emergency department, and taking all the precautions to keep everybody safe. I wanted to mention something that's happened to me personally. Actually, my father had to go to the emergency room 4 weeks ago, and I know stories of people that have had strokes that I've come into contact with in the past. A lot of times, especially an older person, will avoid going to the emergency department because they think, oh, I just don't feel well. Oh, I slept on my arm wrong. It doesn't move, but it's going to be okay. I'm just going to go lay down. And they'll wait because they know something's wrong, but they don't think it's anything major. And the problem right now is, and I've heard this from people, is they're afraid to go to the emergency departments, not even so much because of the COVID, but because they have to go alone. And that becomes a very big issue, especially for an older person. Their child can't go with them, their spouse can't go with them, their neighbor can't go with them because they have to go to that emergency department alone. And that is a very frightening situation. I was on the receiving end of that when my father had to go. So I do understand that, but that I think is a big message here, is that we have to let people know that our emergency departments are safe places and the people need the care. And I'm sure every system in this country is doing their best to take care of the folks that need care. But unfortunately, that visitor issue is really I think it stops people. It stops people from making the right decision sometimes.
This is Stephanie.
Yes.
Can I just add on to what Julie said? That was a super important point. We do know that, when 911 is activated for stroke patients, that 2/3 of the time it's actually a bystander who's calling 911 rather than the stroke survivor or stroke patient himself or herself. And, that makes total sense because often, they're suffering from a physical or speech difficulty that's making it hard for them to call 911. And so I just wanted to also just reinforce, if you have loved ones who are sheltering in place at home, and sorry, that would be my telemarketers calling my home phone in the background, but that you stay connected with your loved ones, frequently via, Zoom or even via telephone. And if you do detect any signs of stroke, that you call 911 on their behalf. And the easy way that we teach people to remember those stroke warning signs is using the acronym FAST. F for face drooping, A for arm weakness, S for speech difficulty, and T for time to call 911.
Thank you so much. And I'm going to give everyone on the call another minute if you'd like to go ahead and enter any additional questions into the chat. And if I accidentally missed your question, please re-enter it, and we'll give you just a minute to do that. And if there are no additional questions, we will close here in just a minute. So I'll give everyone just a minute to type in any additional questions that you have or any follow-up to what we just discussed. And in the meantime, any additional comments from any of the panelists or anything that you'd like to say in closing, please feel free to do that now.
I would just like to add one comment. There was a question about African American support services. I'm not familiar whether we have any kind of separate services for African American, but yes, I have previously worked in health disparities research. It is very well known fact that African Americans and minorities, they do have all the risk factors much more prevalent as compared to non-African American, like high blood pressure, and they do have higher risk of heart disease as well as stroke risk than any other population. So this is something which is modifiable.
Thank you, Dr. Sidar. Anybody else on the panel like to add anything or any comments as we close up here?
This is Stephanie. I just want to encourage everyone to once again do whatever you can to share resources with stroke survivors or our family members during this American Stroke Month. So thank you all so much.
Thank you so much, Stephanie. Anything from Erica or Julie in closing?
I think just to piggyback onto the conversation we had earlier about patients not presenting. While we don't have a lot of data over the last couple months, at least, from our program, certainly we're seeing less patients at the hospital, but I would say patients that are more sick that are suffering from more disabling strokes. And I think the concern is that there's many of these patients maybe with maybe less deficits that probably remain at home or potentially poor candidates for treatment that we missed an opportunity to maybe help or maybe are at home now with those deficits and aren't able to receive the care that they need. So I really would encourage that they call 911 when those symptoms start, but if you're in a situation where you're at home and maybe have had these symptoms and haven't been evaluated, that certainly getting in contact with your primary care provider to make sure that they have the best plan of care in place for you moving forward.
Thank you so much. Anything from you, Julie?
Yes, I just wanted to say, just because I tend to be on the receiving end of this, like the later part after somebody's been through this experience, I just want to say there is life after stroke. So I know we've talked a lot about, the fear of having a stroke, and yes, absolutely modifiable, treatable risk factors need to be addressed. But those people that are out there on the call that might have had a stroke, we all know, and I know very well because I know many people that had strokes in their lifetime, and that's just part of their journey. That's part of their story, but there is life after that. So we, in this time right now, I think it's hard to think about hope and positivity, although I want to have it. So there is much hope after somebody's had a stroke. Therapy can be very, very life-changing for folks. And obviously we want to let them know that there's all kinds of great options, including support out there if you're on this journey right now.
Thank you so much, Julie. We're going to go ahead and close now, and I would like to again thank the Bill Phillips Legacy Foundation. This stroke community conversation is powered by support from them, and I'd also like to thank all of our panelists again for taking time to bring your expertise to today's community conversation. A big thank you to all healthcare teams across our region. Your dedication and focus on health of our communities is inspiring. We see that you're working tirelessly through it all, and thank you truly from the bottom of our hearts. I want to thank all of our attendees for joining us today. We will email all resources discussed to the group, and we look forward to continuing the conversation as we plan future events with your feedback and needs in mind. Thank you again, and stay well.